Hello everybody. Today I am going to present my project titled Software for Healthcare and Biomedical Device Management. This project focuses on how software can be used to monitor patients' health data generated from biomedical devices such as heart rate monitors, blood pressure machines, and oxygen sensors. The system is designed for patients, doctors, caregivers, and administrators, where each user has a separate role and dashboard. Patients can upload their medical reports and view live health updates. Doctor can monitor assigned patients and generate prescriptions. Caregivers can view health data with permissions, and admins manage the entire system securely. The main objective of the project is to digitalize health records, enable real time monitoring, and improve communication between patients and doctor using modern web technologies like MERN, Express, React, and Node. Now I will start the experiment and demonstrate how the system works. Here you can see you have started the MongoDB using the command prompt as an administrator. Then we on the server using the change directory server and npm run day where the development connect with the local database. And we have run the client and we open the local host in the browser. Now you can see a landing page. This is the landing page of the application named MediTrack. It highlights the key advantages of the system, such as saving time through automation, improving patients' safety with instant alerts, reducing manual work by digitalizing records, enabling remote health access, and handling emergency situations efficiently. This page introduces the purpose of the platform for the new users. Now let's get started. Here is a new user can create an account by providing basic details such as name, email, and password. The user can choose their role as either a patient or a doctor during registration. This role selection determines the dashboard and features available to the user after login. Now the user has entered as a patient and created an account for himself. This takes us to a login page. This is a login interface where registered users authenticate themselves using their email address and password. Once logged in, users are redirected to their respective dashboard based on their role. This takes us to a health dashboard. This screen shows the patient's dashboard immediately after the patient's login into the system for the first time. At this stage, the dashboard acts as health monitoring control panel, but no readings are available yet. At the same time, the patient dashboard after the health data has been added. Now the system displays live health readings collected from biomedical devices or entered manually. Each vital parameter such as heart rate, blood pressure, temperature, and oxygen levels is showing a real-time values, along with status indicators like normal or abnormal. These indicators help patients instantly understand whether their health condition is safe or require attention from the doctor. The system continuously monitors these values and is designed to trigger alerts if any parameter crosses a predefined threshold. This section shows pictorial health trends using graphs. Patients and doctor can visualize analyze changes in vital over time, which supports better diagnostics and decision making. Next goes complete history of the data we entered manually, which was showing paging effect. Then goes alert history, where the alerts are registered in paging effect. And that bell icon shows emergency alerts and notification module of the system. Here the software continuously monitors patient's health data in real time. When a vital parameter such as heart rate, blood pressure or anything crosses a predefined threshold, the system automatically detects the abnormality and shows it happens. An alert system is generated and displayed on the dashboard. These alerts cannot be just indicators, they play a critical role in emergency handling. Now we go to the home page where we can see the patient ID which was generated by a math random function, and we can see every div tag where every dashboard was written, so we can go directly to the dashboard. Now let's go to the report page. This screen shows the medical reports upload feature available for patients. Here patients can upload medical reports such as lab tests, x-rays, MRI scans. Each report can be categorized, for example, as a blood test or imaging, and optional notes can be added for the better understanding. Once uploaded, these reports are safely stored in the system and become accessible to assigned doctors for reviews or diagnostics, ensuring a centralized and paperless medical recording system. This medical reporting system is a secured system. Now I will demonstrate how can register and log in into the doctor system. First I will copy the localhost URL of the application and open it in an incognito mode window. Using incognito ensures that no previous section or cache data is used. Once the application loads, I click on the registration option. Here I select a role as a doctor and enter basic data such as name, email address and password. Next, I choose the doctor specialization for the available list such as general physician, cardiologist, neurologist and pulmonologist. A pulmonologist doctor who treats lungs. Here the patient is affecting from the lungs. So we have taken the example as it. This specialization helps the system assigns patients correctly and routes medical cases to the right expert. After filling in all the required details, submit the registration form. The doctor account is now successfully created. Now I move to the login page and enter the registration email and password. Once logged in, the system automatically redirects to the doctor dashboard. Here the doctor can view assigned patients, monitor real-time health alerts, access medical reports and issue digital prescriptions. This completes the doctor registration and login flow in the system. Here we have created two login doctor accounts as you can see. These two doctor accounts can help us to explain how the patient works with two different doctors, one with registration with general surgeon, another with a specialist of pulmonologist. So just he can get prescription from both doctors. This all works in a real-time configuration using a socket IO function so that we can demonstrate what is the socket IO function we are working with. There is a find doctor feature in patient management. Patients can view available doctors based on specialization and select one as the primary doctor for consultation and monitoring. Here we selected two doctors and we can refresh the doctor friends where the patient's dashboards can be viewed. Doctors can securely access assigned patients' medical records, including reports, vitals, and precautions with prescriptions for accurate diagnostics and treatments. Accessing is a role based and permission controlled, ensuring that doctors can monitor patients' conditions accurately while maintaining data privacy and security. In this module, doctors can have authorized access. And there we go with the doctor dashboard alerts view. This is the doctor dashboard. Doctors receiving real-time alerts for their assigned patients and can immediately review critical conditions. Let's refresh and see. We'll get a notification. Have we can see that we'll get a notification, and this notification is an hyperlink that takes us to the to the details of the health condition of the patient. So you can view directly with the hyperlinks that we have assigned there. And in this section, the doctor can access all medical uploads by the patients, including lab results, imaging files, and previous prescriptions. Each report is securely displayed with details such as report type, upload date, and patient's information. Doctor can open reports and download them on on-screen view or download them for detailed offline analysis. This feature helps doctors study reports carefully, compare historical data, and make accurate clinical decisions before issuing some prescriptions to the patients he has assigned. Now I will show you how a doctor issue a prescription in the system. After logging in, the doctor selects a patient assigned to them and the doctor enters the diagnostics manually by him, prescribing the medicines for the disease he has acquired and the dosage, how much dosage you have to take, and the frequency and what times you have to take morning, evening dialing, and the treatment duration for how many days he wants to take the treatment. An additional medical device can also be added which helps patients so that he can understand the documentation clearly. Once submitted, the prescription is digitally generated and securely stored in the system with proper security. This prescription is an instant available to the patient without any manual paperwork and the visiting of the doctor manually. Here you can view the prescription preview. The description displays the patient's details, document information, diagnosis, medical list, dosage instructions, and the issue date. This preview ensures the clarity and avoids error before downloading. You can download the feature through the downloading button there available in the patient. When the patient clicks the download button, the system automatically generates a PDF version of the prescription. This file can be downloaded and saved on the device or printed if required. This feature ensures easy access to the medical prescription anywhere, anytime, even offline, while maintaining the data security. This digital prescription system eliminates handwritten errors, reduces paper usage, and ensures faster and safer healthcare delivery. And you can see that the doctor can also write prescription through his way of analysis so that he can describe the prescription details to the patients in the way of his medicine. This allows patients to store prescription online, share them with the pharmacist, or print them when required. It removes dependency on physical papers and reduces the risk of losing medical records. Doctors can also view previously issued prescriptions for referencing during follow-up visits. This helps maintain treatment continuity and improves long-term care. In summary, The prescription module enables doctor to issue accurate treatments digitally. On the patient side, the patient opens the prescription section. The patient can view all issued prescriptions along with the date, doctor name, and the diagnosis and the medicines what he has issued to him. This is the prescription preview screen. The document is displayed in a clean, readable format similar to the hospital prescription. Patient can verify medicine's name, dosage, and the doctor instructions without downloading. If they want, if they can download it and they can use their feature purposes. Only authorized users such as patients and assigned doctors can access this prescription. This ensures medical data privacy and role-based access control, protecting our system securely and providing ensured data clearly. Doctors can also upload medical reports and test results directly from the dashboard. For example, after reviewing a consultation or receiving lab results, the doctor can upload documents such as blood test reports, scan results, and diagnostic summaries. Each report is automatically linked to the selected patients, categorized by type such as blood test, imaging, and prescription, and securely stored in the system security. These files can also be downloaded by the patients with a downloading feature available on the dashboard that you can see through the page. This module shows the real-time messaging feature of the system. Patients and doctor can communicate instantly without delay, enabling quick consultations and faster medical decisions. Messages are delivered in real time using live socket connections so both users can see messages immediately without refreshing the page. Users can securely share files directly inside the chat. This includes medical reports, prescriptions, lab results, images like X-rays and PDF documents. All files shared are encrypted and linked to the patient's medical record system, ensuring data security and easy access. This feature allows patients to share their live locations with doctors and caregivers. It is especially useful during emergency, home visits, or ambulance coordination. Doctors can view patients' live location in the real time for faster response. User can reply to the specific messages in the conversation. This helps maintain context, especially while discussing reports, prescriptions, and previous medical advices. This chart also supports message reactions such as likes. This allows quick acknowledgement without sending an extra message, improving communication clarity. Emoji supports make communication more expressive and user friendly. Patients can use emojis to convey their comfort, communication with the doctor, or urgency during any conversations. Overall, this messaging system improves doctor-patient interaction, reduces communication delays, and enables secure real-time collaboration within the healthcare platform that we have created so far now and have demonstrated to you while working with the Socket.io functionality we have implemented in the project. Now we can go directly go to the home page where we can view the doctor's ID which was also generated by a math random function. And here we can see there is a sign out function where you can sign out from the device, and we have a simple buttons we can directly chat with the doctor, finding reports and finding alert system in the page. Sign out from the system. Now the screen represents the admin login page of the system. The admin role is highly privileged and protected using secure authentication. Only authorized system administration can log in to the manage users, monitoring systems activity and control sensitive healthcare data. This ensures that patients' record and medical reports remain secure and protected from unauthorized access to the system. Now the admin enters his credentials to log into his personal dashboard where he can see the overview of his page that was created by me. After successful login, the admin is redirected to the admin dashboard. The dashboard provides a real-time overview of the entire system, including the total number of patients, doctors, registered users, and issued prescribers, and the prescriptions we had given. All values are dynamically uploaded, allowing the admin to quickly understand system and usage of the performance at the moment. It shows the recent activity and the system health that shows it's connected to the local database with the active symbol there. Here the admin can view the and manage patients accounts. The admin can view patients details such as registration, date, status and role if required. The doctors are categorized based on specializations such as general physician, cardiologist, neurologist, pulmonologist, or others. The admin can view doctor status, activation status, and perform actions like editing details or removing inactivating account. This is a medical report audit module. Admins can monitor all uploaded reports across the system, including lab reports, imaging, and prescriptions. Each report marked with the status of achieved, flagged, or active status. The digital prescription preview can be read, download, or print by the admin, making it secure for the prescriptions declared by the doctor for future purpose. This is system settings action in the admin panel. Here the administrator enables server maintenance mode. When the maintenance mode is turned on, the system immediately blocks all new users for patients, doctors, and guardians. This is useful during server updates, security checkups, or database maintenance. As you can see, once maintenance mode is active, the system clearly shows that the new logins are not allowed in the console, ensuring data safety and preventing inconsistent access. After completing maintenance, the administrator turns off the maintenance mode. Once it is turned off, login access is restored and patients, doctor, or other users can access again using their system credentials. This feature enables system stability, security, and controlled access, which is very important in healthcare applications. To conclude, this project demonstrates how software can effectively manage healthcare and biomedical device data in a secure and scalable manner. The system supports real-time patient monitoring, doctor-patient communication, digital prescriptions, medical report management, and full administrative control. By implementing role-based access, live health tracking, alerts, and system maintenance control, this project shows how modern web development can improve healthcare efficiently, safely, and accessibly. This project can be further enhanced by integrating real biomedical IoT devices, AI based health predictions, and cloud deployment, making it suitable for real world healthcare environment. Thank you for visiting my website. Please like, share, and subscribe. Thank you.